Okay. Good afternoon. It's now 2 o'clock on Tuesday the 9th of June, and welcome to the virtual meeting of the Lincolnshire Health and Wellbeing Board. My name is Katrina Cope, and I am the Senior Democratic Services Officer who provides support to the board. I would like to firstly confirm that today's proceedings will be audio broadcasted and recorded. Can I please remind members of our meeting etiquette? When invited to speak, councillors and officers should unmute their microphones and switch on their video. And when councillors and officers have finished speaking, they should mute their microphone and switch off their video. This will then help with the flow of the meeting. If during the debate, a councillor or an officer would like to ask a further question or raise a point, they are requested to use the chat function and to just write speak as a comment. Requests will be collated by Alison Christie, Programme Manager, Strategy and Development. Alison will also indicate it in the chat when a new item has begun. Members are requested to indicate also in the chat function if they are leaving the meeting. And finally, if members lose connection during the meeting, it is recommended that they end the call using the red phone icon and rejoin via the meeting link. Right, I'd like to move on to the OOP, please. And could I please ask members and officers to confirm their presence once their name is called? Councillor Mrs. Bradwell.
Present.
Councillor Mrs. Bokit.
Present.
Councillor Kendrick.
Present.
Councillor Marfleet.
Present.
Councillor Oxby.
Present.
Councillor Pepper.
Present.
Councillor Mrs. Woolley.
Present.
And Councillor Worth.
Present.
Glenn Garrett, Executive Director of Adult Care and Community Wellbeing.
Hello.
Thank you. Sally Savage, Assistant Director of Children's Commissioning.
Yes, here.
Derek Ward, Director of Public Health.
Present.
John Turner, Chief Executive of Lincolnshire CCG.
Hello, good afternoon.
Councillor Namstadt, District Council Representative.
I'm present.
Thank you. Mark Jones, Police Commissioner. No. Okay. Sarah Fletcher, Health Watch.
Present.
Elaine Bayliss, Lincolnshire Coordinating Board.
Good afternoon, everybody.
Thank you. Jason Harwin, Lincolnshire Police.
Yes, good afternoon.
Alison Christie, Programme Manager, Strategy and Development.
Present.
Can I just confirm, is there anyone in attendance who has not had their name called? Thank you. We'll move on to the first item on the agenda, which is the election of chairman. Now, just before we get into that, can I just highlight that paragraph 12.2 of the Lincolnshire Health and Wellbeing Board Terms of Reference states that whenever possible, decisions will be reached by consensus. In exceptional circumstances, and where decisions cannot be reached by consensus of opinion, voting will take place and decisions agreed by a simple majority. The chairman will have a casting vote. Therefore, at the end of the discussion of the specific agenda item, the chairman will seek to establish whether a consensus has been reached by inviting the members of the board to indicate whether they have any objection to the recommendation. Any member wishing to object must do so via the chat function by typing the word object. If no objections are received, the matter will be approved by consensus. And then in exceptional circumstances where decisions cannot be reached by the consensus, voting will take place. Can I just ask everyone to turn their microphones off, please? There is some reaction. Right, I would like to now invite nominations for the position of chairman for the year 2021.
I would like to propose Councillor Sue Woolley to be chairman for this forthcoming year.
Thank you very much. Do we have a seconder for that? Has anyone indicated, Alison, that they would like to speak?
I will second that.
Thank you very much. So we have a proposal then for that's been proposed and seconded for Councillor Woolley. Oh, do we have any other nominations?
No, there are no more nominations. Councillor Worth said would like to speak. Is that just to second?
Was that to second, Councillor Worth?
Yes, it was just a second, so I've cancelled that.
Okay, thank you very much. So if there's no other nominations, then it is proposed that Councillor Woolley become the chairman of the Lincolnshire Health and Wellbeing Board for the year 2021. Is the board in agreement?
Yes.
Yes.
Agreed.
Yes. Agreed. Okay, that is therefore carried. So we then move on to Councillor Woolley, please.
Thank you very much indeed, Katrina, and also thank you, colleagues, for your continued support. It is much appreciated. Can I now move on to the election of Vice Chairman? I would like to propose John Turner. We've enjoyed a very close relationship with our health colleagues, and I would very much like that to continue. Can I ask for a seconder to my nomination?
I'll second that. Councillor Ron Oxby here, and he's got a very nice blue cup. Well,
Thank you, John. Thank you, Ron.
okay.
And so can we move on to the vote, as it were? Is there anybody who is violently disagreeing and wishes to put it in the chat function? Can I therefore, I can't see any comments at all. So if Alison, you could just support me on that.
Yes, I can confirm that's correct, Councillor Woolley.
Okay, well, in that case, I would like to sorry, I'm just trying to do two things at once. I'm not doing a very good impression of the feedback here. I therefore state that John is the Vice Chairman of this particular board for the forthcoming year. Thank you. Can we now move on to apologies for absence, please? Katrina.
Apologies so far, Chairman. We've received from Heather Sandy, Executive Director of Children's Services, and Sally Savage, Assistant Director of Commissioning Children's Services, is her replacement for this meeting only.
Thank you, and thank you, Sally, for stepping up to the plate.
Councillor Woolley.
Yes.
It's Ron here. Might it be an idea for you to switch your camera on? We have had Chairman and Vice Chairman on the screen at all times. It'd be nice to see you, as you're doing most of the talking, to be visible. I don't know if everybody's agreeable to that.
Thank you, Ron, for pointing that out. And I am sorry, I should have apologised to you all at the start of this meeting, or at least once I'd been elected. Unfortunately, I live on the very periphery of reception or Wi-Fi or whatever it is. If I turn the camera on, I completely lose you. So if I can beg your forgiveness, but just say that I will be here in audio as long as that's acceptable to everybody else. But it just means that I keep a consistent link. Otherwise, I shall be dialing in all the time. So, but as I say, I do apologise for not mentioning that in the first place. Declarations of councillors' interest. Do any of the councillors have any declarations of interest? Again, I will take that as a no. Can we therefore move on to the minutes of the previous meeting, which was held on the 4th of February? And I am asking you if this is a true and correct record. If I don't hear from you, I am going to propose them and ask for someone to second them, please.
I'll second that, Councillor Bouquet.
Thank you, Wendy. The action updates, which you should have received, I wasn't going to read them all out unless you really wish me to. Has everybody seen them? Are you comfortable with them all? and that they have been discharged. Again, I will accept the silence as being affirmative. And then likewise, Chairman's announcements. The only things that I would like to add to Chairman's announcements is that I wanted to make sure you were aware that I formally wrote to Dr. Kevin Hill to thank him for his time as Vice Chairman of this board. It was invaluable having the expertise of a GP alongside us, and very much appreciate the time that he gave up. And then the only other thing is that COVID has meant that we've all had to sort of do a little bit of navel gazing, and so there is an offer from the LGA to look at a refresh stroke reset of health and wellbeing boards. In other words, are our priorities correct? Do we have the right membership? Do we want to actually raise things up that, although we agree they're important, have become even more important? I've been helping at a national level with a piece of work, and one particular council has said their air quality, they've realised, particularly in town centres, is so much cleaner and so much better that they are actually moving that up the agenda. So we've accepted the offer of a facilitator from the LGA, and that's a piece of work that will be going ongoing. And then in September, when we all get together, we'll then look at things as where we probably want to improve or change things around. And I'm really happy if you would like to be part of this working arena. I'm not going to say it's a working group, but Alison is collating all the information. So if you want to take a practical part in that, then please get in touch with Alison. Okay, don't think there's any comments. Can somebody let the Police Crime Commissioner in, please? We will now move on to discussion items, and this is an update on the Lincolnshire CCG. Just before we went into lockdown, as you will recall, the 4 CCGs became one, and so we've asked John if he would just come and give us a bit of an update as to where they are now. So the floor is yours now, John.
Okay, thank you, Sue, and afternoon again, everyone. Thanks very much for your support for me into the role as Vice Chair. I shall do my best to serve the Health and Wellbeing Board over the next 12 months as best I can. Although the item is around the new CCG, and I'm not intending to go into the COVID handling and our experience and where we are today in any depth. Obviously, I'm happy to, if any members of the board have got any questions or comments in relation to that. But I think it's probably just important to note clearly we are still going through a very profound and serious situation with COVID, and I would just like to say thank you for the support of colleagues on the board. Obviously, to acknowledge the great support we've had from the public of Lincolnshire, and also the huge work that health and care staff and the wider sort of key workers cohort have done on our behalf across the county. And of course, we've still got a very long way to go with the pandemic. So if I could just move on then to give you a brief update in relation to the new CCG. So you'll all be aware that during the year 1920, we're progressing the work to create a new CCG for Lincolnshire, merging the predecessor 4 CCGs, and that new CCG did come into place on the 1st of April this year. Because of the focus on the pandemic and the NHS's response to it, we felt it appropriate to keep the launch of the new CCG as low key as we possibly could, to enable everybody's time and energy to be focused on the response to the pandemic. So at the beginning of February, we had a set of plans and intentions in relation to the early days and development of the new CCG. Obviously, by the beginning of March, we were having to repurpose our resources and our thinking somewhat differently. In terms of the new CCG, just to confirm that the board is now in place. So some of you may have spoken with our new chair, Sean Lyons. Sean has been very active since taking up the role as chair. Sean has a background in engineering, management and leadership in the steel industry, including at one point having been the site director at Scunthorpe. Sean also has had some prior experience of the NHS as the chair of the Sherwood Forest NHS Trust 2013 to 2016. We have 7 non-executive directors. Sue Liebert, Pete Moore, who I'm sure was known to County Council colleagues, Jerry McSorley, Murray MacDonald, Janet Ingram, Fenella Chambers and Jim Connolly. So just very briefly, Sue Liebert works in OD and change management, running her own company. She's also on the university court, and she's a deputy lieutenant for the county as well. Pete Moore, as you'll know, recently retired director of finance from the county council. Jerry McSorley, who's had retired a few years ago now as an NHS Trust Chief Executive, having served in Nottingham, Leicester and Derby. Murray MacDonald, Murray is Chief Executive of Housing Association out on the east coast of Lincolnshire. He was also, until he took up post here, the Vice Chair of the Community Health Trust. Janet Inman has a background in sports management and leadership, having worked both in the county and at a national level over many years. Prior to that, she was in education. Fenella Chambers is a lawyer, working in the county with a particular interest in social enterprise. And Jim Connolly is a nurse by background who's worked at CCG and also national level. So we've got a very experienced, I think, very rich non-executive team. In addition to myself being the chief executive, we have a new director of finance, a chap called Matt Gaunt. Matt has joined us from a role in the CCGs in Lancashire. And we also have a new director of nursing and quality, a chap called Martin Fahy. Martin is actually taking up post next Monday. He comes to us from the NHS in Birmingham and Solihull. Prior to that, he had worked at NHS England. And to complete the board, we have 6 clinical leads from across the county. 4 of these are currently in post. So these are senior GPs. We have Dr. Andrew Dodrell, GP in Boston from the East locality. Dr. Majid Akram, who's a GP in Market Deeping from South. Dr. Dave Baker, who's a GP in Grantham from our Southwest locality. And Dr. John Parkin, who's a recently retired GP in our West locality. We also have 2 further GP roles on the board from across the county, which we haven't progressed the appointments to yet because of the pandemic. And finally, we have Dr. David Boldy as the secondary care clinician on our board. David is retired now, but was previously a physician at Pilgrim Hospital. So those are the key sort of personnel on our new CCG. I wanted to emphasise to the board that we do see ourselves as a new organisation, and we're trying to establish and set ourselves up as new. So clearly we inherit staff and a lot of good work from the predecessor CCGs, but we do want to be, as I say, a new organisation. Our budget for commissioning for health in the county is about £1.25 billion. And obviously we now serve as one CCG the whole of the county of Lincolnshire, i.e. our boundaries are now consistent with those of the county council. We think that the purpose of the CCG is to seek to achieve improvements in 3 areas. Firstly is to improve the overall health of the population of Lincolnshire. Secondly is to reduce health inequalities in the county. And thirdly is to ensure that when people need NHS care, it's great care. And to achieve those objectives in the years ahead, clearly we need to work very closely with partners across the county and indeed outside of the county as well. So the process that Sean Lyons, our chair, and I are taking forward is one of having a very open mind, I think some fresh thinking about what we want our CCG to be and to do. So we are in that sense a bit of a blank canvas, and we want to work with partners to shape and determine our role as we go forward, and to look at how we can genuinely add value to health and the NHS in the county. In the NHS world at the moment, there's a lot of thinking going on about what is commissioning and strategic commissioning for the future, how we're going to move forward to become an integrated care system with our partners locally. How do we take forward our intentions under our long-term plan? And on the back of the current COVID experience, there is a lot of discussion nationally as well as locally about how we reset the NHS. The new CCG board has met on a couple of occasions now. We are trying to meet in public where the technology allows. We have some learning we're going through in relation to that. And we're going to use the next few months to reflect on all of the feedback we've had from colleagues in the County Council, in the NHS trusts, in primary care, from our colleagues such as Health Watch, and others across the county to really work through the next phase of how we can use our role to make a real difference for the people of Lincolnshire. And Sue, I'm happy to talk about the COVID response if that's felt appropriate. But I think it's important just to reflect that over the past few months, despite the obvious extremely serious situation that we've been in, there has been, I think, a lot of really strong and effective joint working and partnership across the health and care system in its widest sense in Lincolnshire and with partners. I think we felt that over the past couple of years we have worked well and effectively together, but the COVID experience is causing us to reflect on how much further that joint working has gone in the past few months, and frankly, how much more has been achieved for the benefit of the people we serve. So we are looking to take stock, not just ourselves, but with others as well, in terms of what we can learn from that, in terms of developing the role of our new CCG, and more importantly than that, developing the partnership working, the integration across us all in Lincolnshire to improve health, reduce health inequalities, and ensure that people get great care when they need it. I'll pause there, Sue. I'm very happy to take comments or questions from anyone.
Okay, thank you very much indeed, John. And I would echo the comments that you made around the joint working, the partnership working. I would like to think that part of our COVID response has been because our working relationships with all of our colleagues within the health setting and within councils and broader within that LRF family have all been pushing in the same direction. I will open it up for questions or comments from anyone. If you could go via the chat function, and then I can see who wants to say what. So we've got Wendy, you would like to speak.
Yes, thank you. Good afternoon, John.
Hi, Wendy.
How are you?
Yes, I'm in reasonable fettle. Thank you very much. Hope you are too.
Yeah, not too bad. I just want to know how you've handled relatives with having relatives in hospital. How we've been dealing with keeping relatives in touch with how their family's getting on in hospital, especially county.
Okay, I could only make a few general comments, Wendy. That's probably better placed for Andrew Morgan. I don't know if Elaine Bayliss would like to make any comments as well. I think in broad terms, as you know, we've effectively, not totally, but pretty much cancelled hospital visiting over the past few months. Although interestingly, there was an announcement just a few days ago by the government that that is to be relaxed. And whilst our hospital services have been extremely busy with COVID-related patients, clearly many of our hospital services have been much quieter. So I do know that be they community hospital services, our mental health services, or indeed our acute hospitals, they have been working hard to try to keep relatives closely involved and engaged with the care of with the patients. And I'm not aware of any concerns having been raised in relation to that, Wendy. Clearly, if you're aware of any, I'm happy to take them on board and share those with colleagues. but I'm sorry, I'm not that close to the specifics. I don't know, Elaine, if there's anything that you would like to add.
Elaine, do you want to come in?
Okay, thank you, Councillor Woolley, Councillor Boker. It's a great question. So we've done our real best across all of our hospital sites. This has been a really difficult situation for our staff in particular, who have been doing their very best to manage the patients' medical conditions and treatment at the same time as looking after their emotional health and well-being. And so we have enlisted an army of volunteers who have done lots of running backwards and forwards with messages, not directly to patients, but passing them through so that staff on the ward can pass them on to patients. And we have embraced technology in a way that you wouldn't believe, in terms of iPads and iPhones, and using those directly with the staff so that they can set them up for the patients who are not familiar with them. And people have had, I wouldn't say Zoom parties as such, but people have had some very good conversations, meaningful conversations with their loved ones whilst they've been in our care. Thank you, Councillor Bradwell.
If I could email you both then with we've had problems with a family member and a local person in Wainfleet that we've had great difficulties with the county, so not good at all with the responses that we've been getting, but I'll email you separately after the meeting.
Okay, that's fine, thank you.
Thank you.
Okay, thank you for that. Hugo, Councillor Marfleet.
Thank you, Sue, and congratulations again for another year. And just like to say to John, actually, congratulations on your role as Vice Chairman, and really thank you very much for a very good summary of the new CCG. I absolutely behind it all the way. I think it's great news for Lincolnshire as a whole. I think to combine into one aligned with the county council is just the way forward, and I think your whole approach and what you've just summarised up, that you view it as a new board, and you've got a whole new team, and I think my view is I wish you all well. Fantastic news, like what I've heard, and look forward to it. And I think you're going to have some fantastic opportunities. And I perhaps shouldn't say it quite like that, but there will be some radical reforming going on, which will, I think, help us out. And some of the sort of technologies and the way that we've worked on the back of COVID, there'll be so much to take forward and new ways of working that I think you're in a great place to transform Lincolnshire's health for the better. Thank you.
Thank you, Hugo. I really appreciate those comments. They're very, very, very kind of you. Yes, you're quite right that particularly on the digital side, but not only the digital side, I think we feel we've achieved probably more in the last 2 or 3 months than we might have achieved in the next 2 years in terms of the take-up of digital solutions, be they in hospital services, in mental health, or in GP services. So that's a great area to identify in terms of there's been good success there. We need to just reflect on that, but we can only go forward from there. I don't think we'll be going back at all. Something else I think it's fair to say has really come to the forefront nationally, and I believe this is something locally we'll need to think about. And I think particularly there's a role here for the Health and Wellbeing Board to help our thinking, is the focus on health inequalities. I have heard more from my regional director and the national NHS England leaders about health inequalities over the past couple of months, really, than I think I've heard for many a long year. So the whole public health type agenda, I think we're all going to be asked to really step up on more. And as I there's more that we should be doing to support those communities in particular, where we know there are significant levels of deprivation and people not in great circumstances, where we know that life expectancy isn't as we would wish it to be, and we know that the populations there have a significant burden of health that they're carrying in terms of chronic disease and so on. So I think again that's something that we'll probably want to return to in the Health and Wellbeing Board going forward. But I'm in no doubt that the NHS hierarchy regionally, nationally, are really, I think, recognising that much more needs to be done on health inequalities. And of course, we can only do it together, can't we? With our county council and district colleagues, but also with a whole range of other partners serving these communities. Thank you.
Okay, thank you for that, Hugo. Councillor Bradwell, Tricia.
Thank you, Chairman. Yes, I'd like to wish the new CCG board good luck for the future and look forward to working with you all as we've been doing in the past. I just wanted to talk about primary care, and you've spoken about how the hospitals have worked in the COVID-19 situation. We all know that your A&Es have not been busy. And for me, it's how do we achieve that going forward? I'm not saying nobody should go to A&E, but the right people need to go to A&E. And we have had these conversations for years, John, haven't we? And for me, we have to pump prime that community health services because there's so many vacancies there. And we have to get GPs doing what they're meant to do. And I know a lot of them do, but a lot of them don't. And I feel with the Zoom conferencing and that, which is all very well. I mean, I do my, Ask My GP. I'm able to ask my GP because I can use a computer. An 85-year-old, some might be able to ask their GP, but some won't. And I think going forward, there has to be the person who goes to see your GP as well as doing it online. I fear that GPs, and I've heard GPs recently say, oh, this is much better. We don't see anybody, but we see them online. I don't think that's acceptable. But I do think we will only be successful if we get those services, running in the primary care area, and then everything else will fall into place. Because, it's the same with any service, with children's social care. If we don't have those preventative services working effectively, then our child protection would be overworked. Do you know what I mean? The caseloads wouldn't be sustainable. So I think this is a chance. We have a chance now through recovery. How do we shape the bit in the community that is going to take the pressure off those front doors of the hospital? And I mean our big major hospitals, not our urgent care centres. They're brilliant. So I just think, and you talked about health inequalities. Well, actually, I would say in the rural areas, even in the nice leafy areas, we have health inequalities because people just can't get the services they want. And for me, that's why I'm asking, or probably pleading, that we get the community health services, the GP services, and what we do in our area in the county council, working so closely together that we can nip people before they need to go into hospital.
Thank you. Do you want to come back on that, John?
Yeah, absolutely. Thank you, Tricia. I think I agree with everything that you've said there. In terms of getting investment and the focus right on sort of community and primary care, again, actually immediately prior to the pandemic, we were in pretty advanced conversations with our community services trust about a significant sort of step change in investments in the community health side of things for the reasons you mentioned. As you'll be aware, the Chancellor has advised us to crack on and do the right thing in terms of the pandemic and not to be constrained by financial matters. So not all, but many of the things that we were talking about with LCHS have progressed through the pandemic. And the point you make about prevention is absolutely at the heart of our long-term plan. We all know, don't we, that prevention is better than cure. That supported self-care is something we can do much more with. Interestingly, on the GPs using digital, many of them are saying to me, "It's great, but I still have patients who I need to physically see and touch." So it works well in many circumstances for many patients, but certainly not for all. So that might be because some patients might not be quite digitally enabled, but also quite a number of conditions do require GPs to physically see their patients. And I take on board the point about health inequalities as well. I think that the points you made, Tricia, are those that I think we should be returning to through amongst others, we should be returning to through the Health and Wellbeing Board over the months ahead, and perhaps exploring and noticing what we have done to progress these points, and equally, quite frankly, those that we haven't progressed and we feel we need to put more focus on.
Thank you, John. Councillor Nanstead.
Yeah, it's just a point about, you mentioned about health inequalities, which is really good that reducing health inequalities is right at the top of your priorities, but where does mental health stand in this? Because it's not just the effect of COVID and on people's mental health, but the general issue of mental health, which is the cause of significant problems for a lot of people.
Yeah, that's a really, really great question. We are really concerned in the health service, locally as well as nationally, about the mental health impact of all of this. And we've actually set up a sort of multi-agency mental health recovery cell to try and scope out and action how we respond to things going forward. So to give you a few ideas about what we will be looking at, clearly the pandemic and the situation immediately with lockdown has caused a number of immediate issues. Sometimes that's patients who had pre-existing mental health conditions that have been exacerbated over the past few months. Clearly, we have people in Lincolnshire, thankfully proportionately fewer than just about anywhere else in the country, but nonetheless still a significant number of people who've become bereaved through this situation, who need mental health support. I think we have a wide number of people across the health and care system who have had an extremely difficult emotional time working in care homes or working in the NHS, who will need some additional support. We know that there have been increases in matters such as domestic abuse, and we're all concerned about things like the suicide rate as well. So these are massive issues for us. But also looking forward, if that's the right terminology in this situation, I think that the mental health consequences of the economic impact that is ahead of us in Lincolnshire could be really very significant. As you know, there's a strong link between poor mental health and job insecurity. We clearly don't know what the economy will look like as we come through this. So under the Mental Health Recovery Cell, which is being led by Brendan Hayes, who's the Chief Executive of the Partnership Trust. But this is about mental health across the county. It isn't about the Partnership Trust. We are looking to draw in national and international evidence about how we can best plan, prepare and act for what we're already experiencing, but we're anticipating ahead being very significant mental health consequences for our population. So I'll pause there, but you'll get a sense just about the breadth and depth of our concern and the range of thinking and actions I think we will need to progress.
Yeah, just one point. Obviously, it needs funding as well, because if there is an increase in demand, that needs to be met as best possible. What's being put forward in suggestion of increasing funding for mental health services?
Well, I think just at the moment, the financial settlements for the NHS going forward is not clear. Clearly, prior to the pandemic, we had statements going back to Theresa May's announcement in 2018 about the additional investment in the NHS, which then, of course, Boris Johnson, when he became Prime Minister, made a number of additional statements, particularly around the general election in December. So clearly how all of that plays through in the light of the pandemic is yet to be clear. But the NHS at the moment is receiving, I think, unprecedented financial support for obvious reasons. Our colleagues in mental health I think have stepped up to the plate remarkably well. But what the county will require in terms of the long-term mental health recovery, the investment and the actions, we haven't yet sort of crystallised. But I have a very strong sense nationally as well as regionally of significant concern for the mental health of the population, and the priority that was attached to mental health prior to the pandemic, I can't imagine will be diminished as we come through it.
Thank you.
Thank you for that. Councillor Kendrick.
Firstly, John, I wish you well with the new CCG. I seem to remember when I started out in the NHS back in the 80s, we had sort of one or two health authorities coming to the county, and then it became one, and so on and so forth. So I think a county-wide CCG is greatly to be welcomed. My question is related to some extent, well, mainly to do with the COVID-19 outcomes. We were struck by the number of people who volunteered to help in the NHS at the outset. I think 750,000 was quoted. Obviously, I come from a background of having managed volunteers for the Partnership Trust for many years, so I've got a personal interest in this. But I'm a bit concerned that when this is over, we don't lose a vast number of these people, that they can still be retained within the service in some way or another. And I was following on from Councillor Nannerstead's remarks about mental health. Obviously, volunteers play a very important part in supporting people with mental health issues, but right across the board in acute care and community care, there's a role for volunteers in all these. And I know I work with colleagues. I had an opposite number at ULH, who I used to work with. But I just crosses my mind that we've had this great upswell of support for the NHS through volunteering. And then when hopefully things return to some semblance of normal, these people might fade away and we lose all that support that we've got. I appreciate quite a number will cease to volunteer once the crisis is over, but I was just wondering if any thought has been given to how we may maintain some degree of involvement.
Interestingly enough, I was in a conversation this morning with Debbie Barnes, Glenn Garrett, and Chris Weway and Michelle Jolly from our voluntary engagement team in the third sector, and this was at the heart of the discussion we had. It's clearly, we have the voluntary sector, and then we have volunteers, and it's not quite the same thing, is it? But the overall sense is that there has been a massive amount of very welcome input from volunteers across the communities in Lincolnshire. I think Debbie said something like 9,000 from memory of people have come forward, and we reflected that exactly the point you made, that we want the voluntary sector and volunteers to be, a fundamentally important part of our overall health and care service and system in the county going forward. Clearly, there's already a lot of brilliant work that was already taking place, and we don't want to be. I mean, personally, I reflect on the London Olympics. There was a great sense, wasn't there, of a huge volunteer army, and my observation is that seemed to have kind of dissipated, within 12 months of the Olympics, and we don't want to be in that sort of a situation. So in that conversation this morning, we did talk about how we can, put our arms around the volunteers. You're right, many of them are already saying, I need to go back to work or something else. So we're clearly not going to hold on to everyone, but I think a significant proportion, there's an opportunity there to our voluntary sector, by the way. I think many of them have had a very tricky pandemic, a lot of concerns over funding, whilst at the same time having had additional demand for services. They've had problems with PPE and things like that as well. So without being able to specifically answer the question, just to assure you that is very much at the heart of our thinking. And I think there's something quite remarkable about how communities in Lincolnshire have responded, and we'll need, I think, the support of perhaps yourselves, other county councillors, as well as the Health and Wellbeing Board, to continue to identify, encourage and support and corral what I hope will be something in terms of the volunteer effort that we have as an ongoing feature of our health and care system for the years ahead.
Thanks very much. It's encouraging, John. Thank you.
I think the one thing of note that I see popping up time and time again, particularly with the volunteers as opposed to the voluntary groups, is because people have been in lockdown, there are so many that ordinarily would not be volunteering because they would be out at work, and they're the ones, and particularly there seems to be an age group, the 30 to 40 age group. There are others as well, and I know, but they really have stepped up, and the commitment that they've made has been quite incredible. But of course, the minute they are able to go back to work, they won't be able to do both things, but it is hanging on to them for weekends and holidays, as it were, when they can support their communities. But I think that in turn they've been given enough confidence to know that there are others round them that will indeed support them as well. So it certainly, if there's been a good thing about COVID, it is very much our volunteer capacity. Sarah. we've got Sarah.
Connecting, yeah. Okay, thank you. Just really quickly, I mean, some of what we've just been talking about volunteering, you'll see in my presentation shortly, but just with regards to the digital side and accessing, just before lockdown, we put together a potential piece of work that would actually help those people that find accessing digital health and understanding the benefits of it. And that's not just about Ask My GP, it's about maybe consultations with specialists and the fact that then people don't have to travel vast miles to places like Nottingham and Sheffield to access those services. So we put together a project idea about how we might help to support the public. Now, at that point, it was going to lottery, and then unfortunately, COVID hit, and lottery's complete profile changed to be the real sort of delivery around a lot of the frontline services. But that's still there, and we think that under a new way we could do some work, and we'd really like to work with you, John, about how that might look, and to deliver some kind of online support package to help individuals. And that's not just older people, because actually the work we've been doing, we're seeing a significant number of older people accessing their IT through small.
Oh, we've lost you, Sarah.
First language, maybe those people that are, sorry, have I gone?
You've come back.
Sorry, yeah, I know. I'm a bit like you, Sue. I'm afraid in the middle of somewhere where access is not great. But yeah, and also those people that perhaps communication is always a challenge. So particularly, you know, we would like to work with some of these groups on a one-to-one to get more and more people a lot more confident in accessing health through digital health, but to also, more importantly, understand why it's going to be a really good way forward for people, but that it's not going to be the one-stop shop for everybody, that actually there is acknowledgement that some people will still need to get to their frontline health services. So that's just really a support for the comments that were made earlier by Councillor Bradwell.
Thank you, Sarah. Anything you'd like to add to that, John, at all?
No, Sarah's mentioned that, I think at our last CCG board meeting, Sarah, and yeah, we'll be very happy to continue to work with you on that. I think there's some really, really important points you make there. And of course, that's based on actual evidence, isn't it? In
yes.
terms of the survey, so it's a good place for us to start. Thank you.
Yeah.
Okay. Can I therefore invite? I don't think there are any more speakers, so can I now invite the board to note the update? Thank you.
Sue.
Yes, John.
All of the comments that people are making. Are they being captured as part of the minutes? Because there's a few points here that I haven't been able to quite catch up on as I've been speaking. And I'd like to reflect on them.
Sorry, I believe they are, but let's just ask Katrina to just expand.
Yes, I can confirm that obviously the points raised will form part of my minutes, so they will obviously be out in the public forum when they're finished.
Okay.
Perfect.
Right. We will now move on to item 8B, which is the Healthwatch Lincolnshire COVID-19 Barometer campaign. Before I introduce Sarah, can I just say to everyone, this is an inspired and ongoing piece of work that Sarah's done. And if I understand correctly, Sarah, you were probably one of the first health watchers in the country to realise that there was something that needed to be done within the community. So well done you. And on that note, I'll now ask you if you would expand a bit further to our members.
Thank you, Councillor Woolley, and also thank you for inviting us to feed back what we've found so far. So yes, we were, and what's really, I think, sort of been a positive is that Healthwatch England have used us as one of the health watches, the local health watches to profile. So we've had a significant number of other health watches contact us and ask what we've been doing in Lincolnshire because they would like to replicate it. So it's good to know, but more importantly, the reason we did it is very quickly we knew that the way we were currently engaging with the public, which was very much about face-to-face getting out there and talking to people, we couldn't do literally overnight. But we had a statutory duty to ensure that we were still enabling the public to feed back about their experiences. Now, obviously, at that point, the focus then really turned very much to COVID and how people were experiencing their lockdown and, more importantly, accessing services as well where they had non-COVID symptoms. So we started the work on the 8th of April. And actually, up to date, we've had 2,758 responses. Out of that, we have thousands of free text comments. And I'll come on to sort of what will happen to some of those in a moment. From this, we're actually then going to be doing additional pieces of work. So one of which at the moment we're looking at care homes and domiciliary care and people's experiences in that environment. We also would like to do something around what makes people most proud of being in a Lincolnshire person. And actually some of what we've been talking about, the community volunteering schemes, we would hope would definitely come out in that. I mean, it was fantastic to see within hours the mobilisation of local small voluntary groups and really just groups of people come together to try and start that support immediately. So that was really fantastic. So what we decided to do was to do a barometer survey, which would say, you know, how are people experiencing week on week over a 13-week period their not just their COVID, particularly sort of experiences around their own self, but more importantly, sort of what their how they've coped with things like information and understood what's being asked of them to do, but also really thinking about sort of people's tolerance levels as well. So I'm not going to go to every slide, but I'm going to pick out a few things. And I think for us, one thing that has remained as quite an important area for patients right through is that, that Lincolnshire residents are concerned about those most vulnerable in their society, in their communities. And I think that's just something that brings out the Lincolnshire and are supportive of one another. And that's something that we should all be building on. People's tolerance to information advice is changing slightly. So whilst they're saying that, yes, the information that they're given, if it's a statutory piece of information they can understand and it helps them cope, they really are not happy now with media and very unhappy about some of the mixed messages and confusion. For us, really, the real big question is question 5, which was about people's quality and safety of care around services, particularly NHS services. And what we are finding there is that actually, whilst it's still a little bit mixed between sort of 50-50 yes, no, those that do feel that there has been an impact on their health, it is quite significant. So particularly we are hearing from patients where they were midway through treatment for things like cancer and that stopped, and they're obviously very scared about what's going to happen. Stories about people's midway treatment through things like root canal for dentistry, and that literally stopped overnight. But also some positives around people accessing things like Ask My GP and finding that as an option is actually a really positive option for them. So really, you know, that's for us as a Health Watch, the area we're going to focus on. So we started talking to ULHT as well about really understanding why significant numbers of people are still very reluctant to access NHS services, and particularly at the hospital. And ULHT are quite keen for us to focus some of our work on and better understanding why. What's the trigger points to make people feel very unable, reluctant to access NHS services? Because whilst we know that that the services have not been available, we also know that people are very concerned about doing so because they've got fear of contracting COVID. maybe the messages have been a little bit too aggressive at the front door, saying don't come to the NHS services, we're too busy with other things, and just generally maybe, you know, just unsure about what they should do next. So we need to help the system, the NHS, to really better understand, if they're going to focus some energies on communicating with the public about what those messages should be, they need to understand what's the trigger points. So the biggest concerns still remain about things like concern for others, not contracting the disease, people abiding by rules, that sort of thing. But going on to the mental health, which was discussed not long ago, very much we feel that the long-term impact on our residents is going to be quite significant. So certainly for obviously those frontline staff, NHS and care workers that are across the county seeing this firsthand. For people that are bereaved, you know, they've been bereaving in a very different way to what we are used to. Is in a very isolated way, and the impact of that on them may well be at some point in the future, if not straight away. For the lonely and particularly older people, so, you know, talking to Age UK, the message there was that they've got a number of older people that are saying, you know, if my lockdown is longer than everybody else's, this is going to have such an impact on me. I'm not sure I want to continue living, because, you know, I don't have so many years left. And if that is in a lockdown situation and I can't see my family and friends and go and do some of my activities, I'm not sure I want this. And that's something that we really need to think about. We've obviously got people that are very stressed, and particularly in the early days where I think everybody felt ill in the first few weeks, and whether that was just, you know, they genuinely were ill, but people just are feeling fearful of catching COVID as well. And obviously then you've got other areas, so people where they're furloughed and maybe made redundant, and the stress around that. So there's a lot of things around mental health that we personally would like to do some more work on. However, you know, and it's probably wrong for me to say that the pandemic has created some opportunities, but it has. And I think we've talked about the building on community activism, which is really, really important. A long time ago, I think I talked to John, and I certainly have talked to several others about the fact that volunteering across the county, we need to find some kind of momentum. But actually, I think within this, there needs to be an opportunity for people to not necessarily feel that they are being trapped in the traditional route of volunteering, that may be a register of people that are prepared to help in crisis, where they're just signing up with just their email or phone number, might be one way, and they just tap in when we need them. Might be one option as well. We certainly are feeding in all of our survey results each week to the Resilience Forum as part of lessons learned. We have had lots of opportunities to feed into national data sets around lessons learned. For all of us, I think there is opportunities to work differently and to plan differently right across the board, certainly sort of within the charity sector where Healthwatch sits, opportunities to share services, to think about different ways of working. We don't all necessarily need expensive buildings. We could consolidate some back office costs and things like that. So actually we then deliver frontline services much more. I think there's some really good ways of networking and planning to engage much differently, but also a little bit more challengingly for some of us as well. And for many of us, it's about refocusing our priorities because of COVID, I think, to support the public in Lincolnshire. So rather than sort of take too much of your time, we are continuing our reports. All of the reports are available week on week via our website, and we are happy to share them out if anybody particularly would like them, and they are a summary of each week, so we have been sharing them with the CCG and many other organisations across the county. So thank you.
Thank you, Sarah. As I said before, it's an inspired piece of work. Sorry, it's not got a microphone on, but playing back. Can you turn microphones off? Oh, sorry. somebody's forgot. Ah, that's better. Thank you. But just for everybody's benefit, I've already had a preliminary conversation with Sarah that with this reset for the Health and Wellbeing Board, if we can use some of Sarah's information as an evidence base as to where we want to go next. So that was the purpose of inviting her today. Not that it's not interesting anyway, but also that this would be useful to base our case on, as it were. So have I any speakers or anybody who wants to ask any questions? Wendy, thank you.
Thank you. Hi, Sarah. I just wondered, obviously I'm, not obviously, but I'm exec for wellbeing on the district. Have you been in contact with Michelle, with the wellbeing and the TED team? Because the TED's just going live all over the aged, the older people's. We've got that all over Lincolnshire now. So I didn't know if you'd been speaking to Michelle about some of these things, because obviously she's been running the wellbeing through the LRF. And also the LRF have got all the volunteers of all the parishes now on an email. So everyone is recorded who is helping at the moment. We've all had to sign up to the LRF. So they have got a really good data of everyone who's helping, which is absolutely fantastic news. But as I say, I'm sure Michelle would be love to speak to you about some of this, because as I say, with all the TED working that we're doing with the older people in which is over Lincolnshire now, not just East Lindsey. That's just what I wanted to ask. Thank you.
Sarah, can you turn your microphone on?
Sorry, yes. We are linked into the LRF for definite, and I know Michelle and ourselves have been in contact. So certainly we'll make sure that continues, and obviously ensure and certainly you'd hope that sort of Age UK and particularly what their feedback has been as definitely should be linking into Michelle, to ensure that obviously any older people that need support have got access to that.
Thank you. And then Councillor Kendrick.
Thank you, Chairman. Just one perhaps suggestion for Sarah. She was talking about having a database of people who've indicated or have helped in the past and may be called upon in the future. Could I suggest perhaps on the database they include sort of details of what people's skills are and what access they have, for example, to 4x4 vehicles, because perhaps that might be useful in the future if we have some crisis, for example, flooding or whatever. We can call on a selected number of people rather than just calling everyone on the database. So you've got the best use of resources. Just a suggestion.
Yeah, well, I mean, hopefully our volunteer centres or somebody similar would be the organisation that would be holding something like that. So I agree. I think what we want to try and do is ensure that there is less onerous process to sign up, because I think that sometimes is off-putting. Not everybody wants to do something regularly every week and feel that they're going to have to go through lots of hoops to get to that stage. But I think capturing some basics is really part of that and essential. And hopefully the vet, Michelle and Chris and co will ensure that some of that is fed through.
Okay, well, thank you for that, Sarah. Is there anybody else that wants to say anything at all or question? I'll just leave them for a moment. Okay, well, can we therefore go to the recommendation, which is that I am going to suggest to you all that we consider the preliminary results of the first 6 weeks of the Health Watch Barometer Survey and consider any impact current joint health and wellbeing strategy priorities. I propose that. Can I have a seconder, please?
I'll second that. That's a bad word.
Thank you, Trish. Okay, we now move on to item 9, which is the Health and Wellbeing Forward Plan. It's an information item only. Alison, is there anything that you would like to add to it?
obviously, the work we're going to be doing over the summer about the reset work may sort of mean that we need to alter this. So yes, it is at the moment. This is how the forward plan stands at the moment, but I say it's work in progress.
Okay, thank you for that. Any comments or questions from anyone?
So it's John.
Yes, John.
I think as we take this work forward over the summer months, there's quite a number of points that have come up in the meeting already today, aren't there? That I think we'll need to incorporate. You know, the general thing about what is it we need to learn from our COVID experience that will help the Health and Wellbeing Board going forward. The discussion about health inequalities, about volunteers, about mental health. So we need to just make sure that we capture those points, I think, in our thinking about the refresh of the Health and Wellbeing Board.
Yeah, I completely agree with you, and hence the reason why I bit the opportunity or bit the hand off of the offer of a facilitator from the LGA, because it's an extra set of eyes and ears of someone with experience that can just sort of gently make sure that we are incorporating everything, and also support to Alison as well, and the wider team, that we, as you quite rightly say, that we capture everything that we particularly want to. And also this particular facilitator hopefully will do quite a bit of donkey work, in that we'll have individual conversations with you all, so that you can say, although I think I'm wonderful, that there may be other things that we do need to incorporate, and where we ought to be placing a bit more emphasis. I think Elaine made a comment earlier on, and I'm very much of the opinion that this is an opportunity for the Health and Wellbeing Board to become part of our residents' information cycle. I don't think we've got a high enough profile. I think we've got a very useful opportunity now to just raise that up somewhat. So that's the way that I hope that we will go. Okay, well, thank you for that. I believe that's all the items on the agenda. I'm just going to ask Alison if there's anything that I should have included that I haven't done.
No, you've covered everything, Councillor Woolley.
Excellent. Thanks very much indeed. I'll be heading for a fall now then, in that case. All right, everyone, thank you very much for that. In that case, I close the meeting and I wish you well. Thank you. Bye.
Thank you. Bye.
Thank you. Bye.
Bye. Bye.
Goodbye, everybody.